hello, and welcome to another edition of Health Matters.
And Health Focus.
I'm Anna Marie Sinatra.
And I'm Ava San Marco.
And together we bring you Focus on
Health Matters.
And before we tell you the awesome show we have for you today, we want to thank our sponsors who are committed to the community and to this program.
We have Bennett Health and Wellness with Dr. Matthew Bennett. He is a medical doctor who practices alternative and complementary therapies, from chelation to herbal remedies, and how food could help you stay healthy. Dr. Doris Rapp has passed her baton on to Dr. Bennett to continue her work.
And we want to thank Joe DeMarco, who is the founder and a pilot for Wings Flights of Hope. He's flying sick children and adults and their families all over the country free of charge. He also has other volunteer pilots who work with him. You know, in cases like a transplant surgery, people get that call and they got to get there immediately, and Joe and his pilots stay on call waiting for you.
Also, Western New York Imaging Associates with Dr. Frank Mascaro, who provides state-of-the-art imaging equipment to assist you in your time of need. And he is at several locations throughout Western New York. Always ask questions. After all, it's your health and it's also your body.
That's right. You have the right. We're giving you the information, so then you have the power to act on that power, and you can always ask questions of your doctor. So get those pens and paper ready, because it's real important to take down some notes, get this awesome information, and stay focused, because your health
matters. Yes, it is. It's got a variety of things in here. I couldn't believe it when I walked in here.
I'm so glad you found it, and I'm so glad that Ginger, thank you so much, the owner of Sheridan Surgical right here on Bailey and Sheridan, has sponsored this show today to give us so much wonderful information. This place is absolutely incredible.
Thank you.
And before we share lots of great information to everyone that's going to help them so much, I'm excited, you know, as a business development coach, whenever I come across someone who has a small business, well, I guess you're really not so small, you're like a medium-sized business, I would say. A family-owned and operated business since 1956.
Yes, that's right.
Tell us a little bit about that.
Well, the store was incorporated in 1956. My father-in-law, Bob Davis, took ownership in 1972. My husband and I took over in 1998, and now my children are involved. So
wow, 3 generations.
It's all in the family.
It definitely all in the family.
That's really sweet. That's nice. So your children work on site with you now?
One of my children is actually out of the country, but my son is working here currently, and he's been growing with us. He's been with us ever since he was a little guy.
Isn't that a blessing? So you learned from your dad, and your son is learning from you guys.
Absolutely.
That's beautiful. Yeah. That's beautiful. So this place is amazing, Ginger. You have everything here from a Band-Aid to the lift chairs and
wheelchairs and walkers.
We really have it all, and we order just as much as we have in the store. I mean, we really, there's a million things out there that you can get for home health care and aids to daily living and things to just help you get through this life.
Yeah, you know, we talk about that so often too, is I think you referred to it as geriatrics.
Our geriatric population, helping them with their activities of daily living.
Absolutely.
Especially, you know, with your walkers, your commodes and things like that. So you must see a lot of that here, Ginger.
Oh, we do. We see an awful lot. And really, for everything that you can imagine that you have difficulty with, there usually is something that will help remedy it. You know, whether you can't put your shoes on, tie your shoelaces, you may want to get elastic shoelaces, or, you know, if you can't reach your hair to brush your hair, there's long-handled brushes. There's just,
Wow.
Something for everything. If you can't put your socks on, there's something to help you put your socks on. So.
Really? Well, I only have a couple questions for you after the show.
Do you have those grabbers too?
Oh, sure.
Yeah,
sure.
I know those
And a
grabbers.
variety of them.
Oh, you mean I don't have to jump up on a stool anymore when I'm trying to get...
Just grab it up there, you know.
Well, you might have to still. But
So did this stool? Well, I have to tell you, sometimes I grab one of the kitchen utensils and I'm opening the closet door and I'm trying to grab something and it's falling and then too many things are falling on top of me.
Yeah.
So I might have to go home with one of those grabbers today. That's exciting.
yeah, it's great.
Yeah, well, I think we're going to walk around a little bit
bit.
so we could learn some more about some of the ailments that you might be having and some of the things that are here at Sheridan Surgical that can really help you in your everyday life.
Yeah.
So Ginger, tell us about some of the stockings that you have to help us with compression, people who have fluid buildup in parts of their body.
Okay. There are many, many types of compression products, garments that are available to the consumer depending on the problem. You know, if you have a lymphedema patient where maybe they've had a mastectomy and had some lymph nodes removed, sometimes they'll develop edema in their arm and hand, maybe in the breast tissue. There are arm sleeves available, and now they really have, there's some fun colors.
Look at that.
Yeah, you know, you
So you
don't
don't have to worry.
wear,
You don't have to wear all those standard
Absolutely.
colors. Oh,
This is the traditional, which is still fine. Many, many people wear this type of thing, and then there's compression gloves that help keep the edema out of the fingers.
yes, I
You can
see
get
that.
a gauntlet where there's no fingers, but again, it doesn't have to be the old standard beige. A lot of manufacturers are now coming out with colors that they can match the clothing and they can just be more fun. It doesn't
Right,
have
so
to
say
be,
if you're going out for an evening, you don't even have to worry about it.
Absolutely.
You can match your ensemble.
Yes, yes. Also, with the compression, there's a lot of products that will be geared specifically to men, specifically to women. Women are really concerned about sheerness and cosmetics, that they look nice. And so many of the manufacturers now have come out with beautiful stockings. You can't tell that they're compression. And for the men, there's sport socks, there's dress socks,
Wow.
there's running socks, all kinds of things.
Yeah, so you really can't tell.
You cannot tell, and people are really receptive to it.
How nice. Now I heard there's some too with zippers.
Yes, yes. Compression, along with compression, they are difficult to put on. There's no doubt about
You
it.
don't have to tell me.
Yep. So if someone cannot put it on, there's usually they're custom made, and they actually have a zipper with it. So
Look at
you know,
that. You don't even have to worry.
Yeah, I've said people live alone and they have difficulty
Right.
putting them on. It really does help a lot. And again, some of the companies do make an off-the-shelf, but the custom-made, if they have a very edematous limb,
Right, really swollen, yes.
sometimes they need to have custom. So, and they come in black and different colors too. So that's
That's nice, yes, because when you put them on, I'm struggling too. You have to put all the lotion on and everything, whereas here you can just place it on your foot or your leg and just zipper them up. 1, 2, 3, no problem.
Right.
It really, really does help.
in addition to the zipper, there's a lot of different products available. We have what's called there's available a donner, and it's just a metal frame that you can stretch the stocking over. Several of the manufacturers make that type of product too. So a lot of patients will wear rubber gloves
Wow.
to put them on. So there's all
Oh, I
kinds
never heard of
things.
that one. There you go. There's another one. Yeah, it's just to make your life easier to put, things like this on so they can help you live a more quality of life to help you get around.
And again, they don't have to look like your grandmother's stockings anymore.
Yes, that's right. That's true. They come in all sorts of colors. I especially like the green one.
I thought you might, Eva.
Yeah,
Might
there you
match
go.
your shirt.
So Ginger, I understand that a lot of the accidents happen in the bathroom, as whether it's from an injury or as people are getting a little bit older, our mobility isn't as what it used to be. Again, I'm not going to share anything personal in these segments, but I'm just noticing, some of the things that are available to help in that everyday life.
There are a lot of products available to help in the bathroom. Really, it is the first room in the house where you start to lose your independence. You know, you're starting to step over that bathtub, you're on a slippery surface, there's nothing to hang on to. Getting on and off the toilet, that can always be a challenge. So it's really the first room where you need to address your independence.
Important, important. Yeah, I've seen actually in some family members and different friends, I didn't actually know what it was. It's like the toilets seem real high.
Yes,
Yeah,
yes.
so
They make elevated toilet seats, and it doesn't seem like the 3.5 or 5 inches that an elevated toilet seat would make a big difference. But as we age, our elevator muscles, you start to lose them, and it makes
elevator muscles.
I don't know
How
if
cute!
I think I made that up.
Elevator down. I like that. That's cute.
But really, it does make a big difference. Just that little bit of height to get off the toilet.
Wow.
And it seemed, and we all have to do that. So.
Yeah, yeah. Well, I notice it too. If you think about it, when you go into a handicapped bathroom, the toilets are much lower so that you could slide from the wheelchair to the toilet. So if you think about it, as you're getting older, if it's harder to get up and down, every time you're using the facilities, that could be something that'd be really very, very helpful. I know it was hard for me when I was visiting someone. I was like, what do I do with this? It was a little more challenging, but I would imagine that for someone, the elevator muscles, I like that. That could be a real beneficial help.
Yeah, absolutely. In addition to the elevated toilet seat, there's toilet safety rails that someone can put on their toilet, and it helps to push off. So in addition to being up higher, they have something to hang on to. There's all kinds of grab bars available also.
Yeah, I was seeing that. And it seems like it's just suction. You just have to put it on a wall.
It is. And the suction grab bars are really neat. When you think about it, this is how they've been carrying big, heavy panes of glass for years.
Oh.
They really are strong, but they have to be for the right circumstance. It has to be a smooth, non-porous surface, but they do work well. They're very easy to install. It's not always the most appropriate, and for those times they make grab bars that have screws in it.
So you could just screw it right in.
Yeah.
As much as this seems so nice and easy, for me, myself, I would be always so fearful if I was going to grab it and pull with all my weight, it might pop off in the midst of that.
Right, and it has to be the right circumstance, too. You kind of want to give it a tug to make sure that everything's still secure. And it's not something that you hang on or even pull on. It's more for balance.
Oh,
you're getting
I learned something new. Yeah, because that did just my own intuition said, in the midst of it, and boom.
Right.
Yeah, so that's more for a slight, for balance. That's very important.
Right.
Yeah, so when you're in stores and just looking at the stuff, if you're not talking to someone who really knows, who could really help you, might go in a store and get this and not even realize that. So I could see the importance of really speaking to someone like yourself, or like you said earlier, your children who are here to help. And I know I met your husband before too. We're all here to help to educate, so that you know what kind of things are best for your particular situation.
Yes.
Absolutely. So what else can you share with us for what can viewers do right now as they're starting to, whether it's they're suffering from an injury or they're noticing as they're getting a little bit older, things are getting a little more difficult. What can they do right now to help to make their bathroom more user-friendly?
Well, in addition to the wall mount grab bars, there is made bars that go on the edge of the bathtub too. So it's something that you can clamp onto the edge, and again, getting in and out of the tub, that can be a pretty dangerous thing to do. You're on slippery ground there, and so that helps. Also, there's all kinds of bath benches available. So once you're in the tub, if you want to sit down, they can be up nice and high, because again, it makes it easier to get up and down. But that way, a person can sit on the chairs and take their time and wash and do whatever they have to do without worrying about falling.
And they could use it in the shower too, either one?
Absolutely, yes.
Well, isn't that amazing? I would have never even thought.
Yeah. There's another type of bench. It's called a tub transfer bench, and what it does, it goes over the wall of the tub. So the person would be in the bathroom, they'd sit down on the edge of the tub, or on the edge of the transfer bench, bring their legs over and kind of scoot themselves in. So that's nice if someone's had a knee replacement or surgery and they really can't make that step over the wall of the tub.
Wow. There's help for you.
Yeah.
There's help for us. I know I've broken a foot of a knee and a foot and a couple different body parts over the times. And as you're sharing, I'm kind of like scanning my past and thinking how difficult things were, especially if you're in a cast. I was in a cast once, and I was, using garbage bags. I'm trying to hang my foot out the side of the tub, and I had no idea that all this stuff existed.
For a cast, you could get a cast cover to cover it, and it seals at the top, and it keeps that cast bone dry. Oh, yeah.
Do you have any idea how much I struggled when I had my broken ankle? I had no idea. Oh, my goodness. I'm going to stick around and talk to you even a little bit longer.
Right.
That's amazing.
In addition to the bath benches, there's also handheld showers, and that really is a very helpful device. It's something that if you're sitting on the bench, sometimes you don't want the water pounding on you, so you can take this and control the water flow and use it to rinse and soap up, and usually there's a little hanger of some sort to hang it. So that is another item that's very helpful.
That is really nice. I use a handheld just because I like it in the shower, because I don't always just want it pounding down at me. So I would imagine if, maybe for our seniors, if they need to sit in the tub and they want to take a shower, now they have flexibility of how they're going to be able to maneuver to have the best shower that they can.
Absolutely. Another thing, there's other items available. There's all kinds of items, but there's long-handled bath sponges. So if you're a hip patient and you can't reach your feet, now you can take this bath sponge and kind of wash your feet and reach places that maybe you can't bend over and reach.
Wow, how incredible. Just like a backwash, a foot wash.
Right. And if you can't get into the bathroom, or into the bathtub, I should say, you can also get a shower cap. It's a rinse-free shower cap that you put on the head. You can put it in the microwave. You would put it over somebody's head, and you can kind of wash their hair, and then you can take it off. It keeps the dirt and the whatever in the bath cap, and then you can just brush their hair out.
Are you serious?
Yeah, it's a no rinse shower cap. So
oh my goodness.
So even people that cannot get into the bathtub or into the shower, there's answers.
Wow, that, I don't know, I just kind of feel really good about hearing this information, because again, as people get older, so much starts happening. I have a lot of family members and friends, and even my own self, I'm learning, as we get older and older, things just aren't the way they used to be. That's right. We had a couple conversations beforehand too, and to know that, you don't know what you don't know. And again, if we just go into big department stores and we're just picking up things, I might have used this myself in an inappropriate way that would be more harmful. Absolutely. So it's just exciting to know. How could people know? Like, do you ever do seminars and teach people, or you just talk to people when they come in? I mean, this is a wealth of information.
Yeah, typically when someone comes into a store like this, they're usually kind of walked around and what are the problems, and usually we're asking them more questions than they're asking us, trying to paint the picture of what their situation is. And then with that information, we're able to give them some good recommendations on what would be appropriate for their situation.
Wow. I'm thinking about when we first start off and we have children. I'm having all these flashbacks of how important when we're teenagers didn't even use a mat in the shower. We're infallible. We don't need any of it. And then we have children, from my own experience, and you're using mats and you're thinking about safety. And then then somewhere in between, we kind of not maybe pay so much attention, and then all of a sudden
we need it.
Very well said.
Yeah.
Hi, everybody. Hi. I even have a horn.
Can I use your
horn? You got a horn too.
I do have a horn, and I'm pretty sure mine's a little louder.
Oh my goodness.
Oh my goodness.
That woke you up if you weren't paying attention. We got your attention now. This is really fun. I don't think I've ever ridden a go-kart, maybe in one of those amusement parks, but not
bumper cars.
This is really nice, and as we were talking, as we were practicing, I did have to practice a couple times because I didn't want to run into anybody. All I could think about is how these things are really changing lives.
Oh, they're wonderful. They are truly changing lives. I mean, there's so many people that just are starting to lose their independence. And, you know, I mean, when you think about it, if you were going to be pushed in a wheelchair and go to the mall and go shopping, I mean, wouldn't you just rather do it on your own and go yourself and do your own thing and not have to say, push me here, push me there.
Oh, fun.
And sometimes wheelchairs are just necessary, you know. I mean, these are absolutely not for everyone. The wheelchairs are appropriate for a lot of folks, but you know, if you can get this much of your independence back, I say go for it.
So I know we were talking a little bit earlier about your aunt who's at home.
Hi, Aunt Thalia.
Hi, Aunt who?
Thalia.
Hi, Aunt Thalia. She was sharing wonderful stories, and I asked if you were riding around in one of these.
Yeah. Well, she may think she could. At the ripe old age of 96, we're trying to keep her a little bit safer than that. But no, seriously, she does use a lot of aids to daily living and equipment that really make her life better. You know, the power lift chairs, all kinds of things that that make it so she can do things a little bit more independently and get through her life. Yeah.
Wow, that's so beautiful. I was thinking I went to the convention center for one of the big things that they had. And because when you're in a really packed situation, you got to think about your loud bell. And all of a sudden, you know, I heard someone say, "Excuse me," and no one was moving. It was jam packed. And all of a sudden, we heard a big bell like that, and everybody started jumping and moving. And this gentleman in one of these things just cleared the whole aisle with that bell.
Yeah. And hopefully, it doesn't take a loud bell, and people are a little bit respectful of that and can step out of the way. But.
Yeah. So tell me then, so when people come in, and I mean, it must be extremely rewarding. You know, when we talk about people, you know, you might be in a job where you're going 9 to 5 every day and you get a little bored or a little depressed. I would imagine that on one hand it would be extremely emotional to hear the stories that you hear, and on the other hand, amazingly.
It's funny you ask that, Anne Marie. You know, people ask me all the time. They say, "Oh, that must be so depressing to work in a place like that." And I said, it's just the opposite. It's very rewarding. I mean, when you can provide a product for somebody that it changes their life and makes their life easier, it's a great feeling. It really is a great feeling. So it's a great place to be.
Wow.
Helping people.
Wow.
You look at it as a positive.
Absolutely.
Take a positive spin to it. Like people say, oh, it must be depressing working with elderly patients or whatever. No, it's not. To be a part of their lives is very rich and rewarding. Like you said, Ginger.
Is.
Yes.
It absolutely is. And, you know, older folks, they have so much to offer us.
Oh,
and we've got so much to learn from them.
Yes. That's what I think we miss in our society today, too. You know, that our young people, you know, that there's the African proverb that says it takes a village, you know, to raise a child. And then there's a Native American, it's the same connotation, too. And I'm blessed that I had my family for as long as I did. But my children, even my children, miss that they don't have that, because so many of my family is dead and gone. So to be able to have your family members around and then have these things that help you to help take care of them, what a gift. What a blessing.
It really is a gift. And people are living longer. And so if they are going to live longer, get the things that help you.
Yes.
Wow. Wow. And so, Ava, do you have any questions? Don't you work with the...
I work with the elderly population. Like I said, it's very rich and rewarding, and it does, these type of products do help them live a richer and fuller life. I know Sheridan Surgical here is very committed to helping the community. I know because I've dealt with them through work.
That's pretty amazing, Ava, because you working in an assisted living, you actually get to see all these different things and how much they really make a difference in people's lives.
Right, in the end result, and it's just amazing.
It has to make your job as a nurse a lot easier, too.
It sure does,
yeah.
Yes. Both patient and nurse, too. So.
Yeah. I'll bet you're getting lots of, you get to your continuing education every time you talk to Ginger.
Exactly, yes, 'cause there's so many new things out.
Yeah.
And you always,
Yep.
when you call, they're just you keep abreast of certain things.
All different things. And
Yes.
and I like what you said too, Ginger. I was watching Ava come down from the chairlift earlier. You were talking about and all the different things, that you could help to educate people with, that you're a bridge for people too. We were talking about how many times when I go out and I see in front of people's houses the ramp that's built, that you even partner with people so that you could recommend,
Right,
different things.
Right. No one person does everything, but the key is to know is who to refer them to and who to send them to. We've got a great community. There's a lot of great suppliers out there that, and even in this type of business, everybody's different. I mean, they really specialize in different things. So we're constantly recommending our competition for different things. So
Wow.
yeah,
Wow.
we really work well together.
That's really nice. You can have faith and trust and know that you're going to recommend somebody who's trustworthy and who can help, and people who care like yourself. I think that's the biggest thing, my biggest takeaway today is learning all the different things that are available, how much help that there is, and all the education. So thank you. I can just see it in your eyes,
No.
how you shine when you talk about your
I will
I almost
tell
want to say
you.
your patience.
I will tell you, I love what I do. And my husband loves what he does, and we really do enjoy it.
Well, I'm going to just press this little button and say I was really happy to be here. This has been a wealth of information, and I'm out of here.
See you, girls.
Bye. We hope you enjoyed this show and took lots of good notes so you can begin to have a healthier lifestyle.
Also, we want to thank our remaining sponsors, the Healing Spa with Marge Reed, who offers a variety of holistic, non-surgical facelifts and other therapies that help the body into balance wherever it's needed.
And we want to thank Kim Will, who's the owner and head stylist of Mr. Frank's Day Spa, where she is committed to teaching you proper care of your hair and nails, including a medical pedicure. So remember, tune in as often as you can and stay focused because
Your health matters.